Well, welcome back. This is part 4 of Chapter two's discussion, and we're going to go over risk reduction and prevention in this section. And one thing we're all trained in, as an EMT, we're trained in how to handle bloodborne pathogens and how to approach patients who have infectious diseases. Now, and I don't want to kick a dead cow here. I know we know to wear our PPE, so we wear our BSI on all patients. So at a minimum, you'll always have gloves on whenever touching a patient, period. Other than that, you'll need to utilize the appropriate PPE for the appropriate situation. For example, you may need to wear gloves, gown, and goggles, and face protection to cover your mouth, as well as any other protection might be needed. For instance, when you're delivering a baby, you're going to want to wear all kinds of protection because fluids go everywhere. Whenever the call is over with and you're done, you still may need to wear gloves and goggles and maybe even face protection to clean the ambulance, depending on how dirty it is, because those products are still infectious and could harm you. Now, one thing I want to point out too is whenever we're approaching patients who may have infectious diseases, we do not need to go overboard with our PPE. If you have a patient who has HIV, that doesn't mean that you need to double glove and put on gown, goggles, face mask, and everything just because they need transport to the hospital for a sprained ankle. That's a little bit overboard. You need to treat all patients the same. Now, the thing is about HIV and hepatitis and diseases, the people who don't know they have it are the ones that are most dangerous. So if you know they have it, well, then that's a plus for you. And you should be taking the same precautions regardless for everybody. So the Centers for Disease Control developed the standard precautions for everyone in healthcare, so that we have a better understanding of what to wear, when to wear it. The standard precautions, or PPE, or whatever you want to call it today, BSI, it all gives us guidelines on when to wear certain things. If you have splashing body fluids, well, then you need everything. You need the gown, you need eye protection, possibly face protection, and gloves. If you have the possibility of something getting in your eyes, well, then you need to wear your eye protection. Now, if you are exposed, you need to immediately, as soon as you can, now you don't stop patient care, don't stop in the middle of patient care, but you need to notify your exposure control officer or your OSHA officer, or whatever they're called at your organization. You notify them. So you need to be familiar with your exposure control plan that your organization has and know who to contact and when to contact them. Most places there's a narrow time frame that you have to contact or to report an exposure. And all exposures should be reported. You cannot tell by the way somebody dresses or their hygiene or the way they look if they're infected or not. So if you get a needle stick from a well-to-do person from the affluent end of town, that doesn't mean anything. And also children. I see people who will not use standard precautions on children, and that's ridiculous. You need to wear the same standard precautions for every patient, regardless of their age or anything, because anyone has potential to be carrying and can transmit infectious and deadly diseases. Now, the most effective way we have to control disease transmission is one of the simplest things that we can do, and that is through hand washing. And we should wash our hands before and after each patient contact. And if you do not have availability to wash your hands, because I know ambulances and fire trucks and rescue trucks and stuff, and maybe even police cars or any other, or even your personally owned vehicle for some of you do not have access to a sink and water. But there are hand washing substitutes out there, and you should use that in the meantime. And then as soon as you can, you should wash your hands appropriately. Well, this covers this chapter, or not this chapter, but this section of the chapter. And next we'll get into personal protection.